We don't need to see the patient anymore. We have the patient's mouth in our hand.
As the mold, as the thing that's set.
Yes.
Is that also okay? That is a cast.
That's a cast now. You understand?
So from impression to cast.
Get a cast. Okay. Generally, prostheses are artificial substitutes that are fabricated to replace missing body parts. You understand? Now, missing body parts can be fingers, can be eyes, can be legs, can be anything at all. But when we are talking about dental prosthesis, we are talking about fabrication of missing oral structures in the mouth.
Wow.
Like the teeth, oral tissues, appliances that helps to either expand, bring back, retract, and protrude. Yeah, you understand. So these are all prostheses. That's what we are talking about, dental
Prosthesis.
Yeah.
Okay.
So in dental prosthetics, we have so much of them. Now, in dental technology practice, which I'm into, it's divided into different consecutive parts.
Wow.
Which we have a specialist who are really, really broad, and they are so focused in those consecutive parts. One is the prosthetics. The prosthetics talks about the plastic dentures. I don't know if you've seen dentures.
Yes, I've seen dentures.
Plastic dentures. Anything that has to do with plastic. Full mouths, construction of upper full mouth dentures, lower full mouth dentures, partial dentures. Those, as far as it has to do with plastics, those are they are under the prosthetics. Now we have conservatives. Now the conservatives deals more on aesthetics, like the crown and bridge. VFMs.
What veneers?
Yeah, veneers. Yeah, those lies under the
cosmetic.
Yeah, they lies under the conservative side of dental technology practice. Now we also have the other side, which is the orthodontics. Orthodontic prosthesis. Yeah, the orthodontic prosthesis, they are appliances that are fabricated to correct the alignment of the teeth.
Okay.
You understand? There are some persons you see, they have a lot of teeth in the mouth due to crowding. There are some persons you see, they don't have space in the mouth. You understand? All these are originated from maybe the parents, or you understand?
Yeah. So, genetic.
Yeah, genetic. Let me put it that way. Then the appliance we fabricate is either to expand the jaw, to retract, or to protrude. There are some persons, they can't close their lips, just like the way you're closing. You understand? When they close their lips, you can see their teeth coming out.
Wow.
Yeah, so these appliances are fabricated to correct, especially in this practice. We find out also that there are some appliances we call habit breakers. You understand? Habit breakers. Yeah, I'm still talking about the orthodontic prosthesis. There are some appliances we call the habit breakers. These appliances are fabricated to especially stop children from sucking, thumb sucking, lip sucking, tongue thrusting, and so many factors, or so many
habits you want them
habits you want them to break at their tender age, because the more they continue doing that, you understand, it affects their teeth.
Wow.
You understand? So at that point in time, a child that always sucks his or her hands or the thumb, you find out that when they grow up and they did not stop on time, you find out that the teeth protrude out. Why? Because their hand push the teeth whenever they suck. So it tries to give the teeth a different shape from their parental tooth alignment. So in that process, before they go for maybe orthodontic treatment, which is braces, we normally fix them on this appliance to correct, to adjust, or to maintain, or to create space.
Wow.
You understand? So that is for that. And also, when we're talking about another part of dental technology,
the fourth one.
Yeah, again, is maxillofacial.
Maxillofacial.
Yeah, maxillofacial
Prosthesis.
prosthesis. Yeah, there are some maxillofacial prosthesis we normally fabricate, especially for cleft patients. Maxillofacial prosthesis, there are some children that are born with clefts. Do you understand? Whereby the upper roof of their mouth, there's an opening there. And this opening are caused maybe during infancy or during pregnancy. The tissues that forms the
Upper part of it, yeah.
So maybe they didn't fuse together properly. Now there's a defect there. So we normally fabricate prosthesis we fabricate to cover up that hole. You understand? Till maybe the child is ready for surgical procedures. To suture or to fuse in the
upper,
to follow up the proper treatment. So more and more of that when it comes to maxillofacial prosthesis.
Well, thank you so much, Mr. Richard Obi. Really, you have actually explained a lot so far, and I believe that my viewers are actually enlightened. So another thing is, I would want to know, why is it good to have a dental technologist in a dental practice, or have a dental technologist lab in your dental practice? What are the advantages?
Yeah, there are a lot of advantages there, because when it comes to a clinic, the clinic, they focus more on the primary treatment in dentistry. You understand? Like maybe you come, for instance, you have a teeth pain, you want to do extraction. After checkups and or after a diagnosis and or we found out that yes, you're fit for extraction. Now, after the extraction is done, doesn't just leave the patient to go. We try as much as possible to see how we can, fabricate a prosthesis that can help or that can, for the patient, in resemblance and in function. You understand me? Just like, okay, for instance, you lost your teeth, or you had an extraction, leaving that, especially the front teeth, leaving that particular place just open like that is not, it's not the aesthetic beauty. You won't get it there. You understand? So at that point in time, it's very, very important that a prosthetics is done for you.
Okay.
You understand? To, replace that missing tooth in the mouth, so that at least you can get your aesthetics back,
or get your confidence back,
or get your confidence, your smile and everything back.
So it's actually good to have a dental lab in your
it's very, very
practice.
good. It's very, very good. Very, very good.
Okay. So what about dental practices that don't have a dental lab in your practice?
I would say it's bad. I don't say it's bad. You just, in the dental hierarchy, we have so many professionals there. We have the dental surgeon, we have the dental therapists, technologists are there, the nurses are there. So these people are just team of professionals that, make the dental practice work.
So, Mr. Obi, we were talking about prosthesis earlier. So I wanted you to explain to me how they transfer the case. That the doctor transfers the case from inside of the surgery and then over to you in the lab, because I understand that you said these prostheses are fabrications, okay, to replace the natural things that are probably missing, or to help enhance, to expand and all. So for example, now someone has a missing tooth or a set of missing teeth, and the doctor sees the person. How do you get the exact tooth to fabricate to replace it?
Okay, actually, that's why that's why we are professionals in stuff. So when a patient has a complaint of that he or she wants to make a replacement of his or her missing teeth. So after diagnosis and there's an oral examination by the doctor, so a measurement is be taken. That's what we call impression. An impression is just a negative replica of your oral cavity. Okay, let me make it more clearer. It's just like a measurement. How the oral structures look like. You understand?
So you replicate it on the impression?
Yes, on the impression. Now, when it is pushed to us in the lab with the patient's diagnosis, how the replacement is going to be. Like, for instance, there's what we call shade. Like patient shade.
You mentioned that.
Like shades is in our own terms, but in a general term, shade means the color of the patient teeth.
Okay.
You understand me? So we have different shades. We have different color of the patient of a patient's alike teeth. You understand? So just like me, my own shade. If I want to do a replacement, you must give me something that looks like my natural tooth, so that it will be in alignment.
Oh, I see.
You understand me? So that was what we call shade. There are some persons, their teeth are darker white. There are some persons, their teeth are white. You understand me? So that person that has a lighter white teeth, you can't give the person a darker one as a replacement.
For the fabricated
yes
prosthesis you want to replace.
So
yes,
at that
point
in time, when the impression comes to us in the lab, we check
all the information.
Diagnosis.
Yes. Okay. Diagnosis. Okay.
Must be written. You understand me? So we now do our own work in the lab.
In the lab. Oh.
So on that negative impression, we cast it to get a positive replica.
What do you mean cast?
Now, a cast is like it's just like okay. Let me just make everything so
simple, please.
Simple here. A cast is just we get the impression, we flow in another mixture of some
components,
substance inside. We allow it to set. Now, when it's set, we'll bring it out from that impression.
More like a mold?
Like a mold. We're not having the positive replica of that person's mouth.
Oh,
so this time around, we don't need to see the patient anymore. We have the patient's mouth in our hand.
As a mold, as the thing that's set.
Yes.
Is that also okay? That is a cast.
That's a cast now. You understand?
So from impression to cast.
Get a cast. You grab. So we work on the cast.
Okay.
You grab. So the process of, in fact, all those process of doing the preparation, casting the job, making sure that everything falls in alignment, is what entails in the lab. So that is the job of a dental technologist in the lab.
Dental practice.
Yeah, in dental practice.
That's fantastic. So with the impression, what's it called, the cast and everything, you can provide the exact fabrication or processes that will be used by the doctor to satisfy the patient's.
Yes, in resemblance and in function.
When you say in resemblance, I understand, because you talked about the shade.
Yeah.
But what about in function?
In function, the person or the patient can still use it for his or her normal functions. To eat, to bite, to do normal things that.
So you mean you can use dentures to eat?
Yeah, sure. You can use it to eat if you feel like.
Wow.
You can use it to eat if you feel like. Even the normal crown, bridges, you can use it to eat. You can use them to eat if you feel like.
Wow. So the motto of every prosthesis that is being created in the lab is make sure that it is good in function and
in resemblance.
Yes. Wow. That's a good one, Mr. Richard. Thank you so much.
All right.
We really are happy to have you on the show once again. And then I will say my audience and me too, I've actually learned a little bit about the dental technologist aspect or part as a team in the dental practice. Is there anything you would like to say outside of my questions to the audience, that concerns dental health care or dental technologist?
Yeah, I'm going to, talk generally on, dentistry to everyone. It's very, very important to, see your dentist at least once in 6 months to check properly, because the foundation of this whole teeth problem starts from a normal thing which is called improper toothbrushing. You understand? So it is very, very important you go see your dentist once in every 6 months. Change your toothbrush as possible. If possible, once in 2 months, change it. And you come for cleaning.
That's the scaling and polishing.
That's very, very important. You understand? So that's all I have to say. Thank you.
Okay. Thank you so much. So as you've heard from Mr. Richard, it's very essential for you to come to your dentist to make sure your oral health is in check, just to avoid spending money later on or having serious complications that might need a lot of money to fix. So I think going to your dentist early saves you more money and then helps you to fix the problem very, very quick. Yeah. So thank you for staying tuned. Watch out for a beautiful episode of Bellevue Dental Clinic podcast show. Thank you. Have a nice day.